Welcome. So glad you are here with us. If we have not met, my name is Allison Rollins, and I am a passionate person who loves to help people through their transformative life experiences, such as pregnancy, childbirth, and the weeks and months that follow. We really, at High Country Doulas, we really want you to feel like you have the information that you need as you collaborate with your birth team and your pregnancy, and then moving forward into the postpartum as you get support from your providers, your family, your partners, and everybody else, your doulas, everybody else who's involved in that. And tonight's webinar is on postpartum reproductive planning, and I really think it's so important to talk about this topic prenatally. We will talk in our postpartum visits with our providers about what are our options and choices, but I think that you are best able to make those decisions in the prenatal period when you're not juggling taking care of a baby, have lack of sleep, and those things. So let's share a little bit more about that tonight. Before we get started, as I said, my name's Allison Rollins, and I am married, a mother of 3. I'm also a doula. I'm an educator, a health coach, a positive parenting facilitator, and have had specific trainings in perinatal mood and anxiety disorders. And I just consider myself a life learner, and I'm always here to provide resources to families. So let's get started. Welcome again. So excited to have you here with us tonight. If you have specific questions, save those. I'd love to share with you about those at the end. Hopefully they'll get answered as we go through tonight's webinar. If they don't, feel free to email me at info@highcountrydoulas.com or give us a call at 828-278-8949. We really want you to get the information that you need to make the decisions that are right for you and your family. The days after birth, the days after your baby comes can be both exciting and exhausting. You're recovering from birth, and that can often come with a lot of aches, pains, and for the most part, a total lack of quality sleep. Many people feel disconnected to their postpartum bodies. I know I did. It's hard to imagine that you may ever be intimate again, much less have sex, right? But with most of us, we will begin to have those connecting feelings and desires, and you'll want to be prepared when the mood strikes. Considering all your options can feel like a monumental task, even on the best days. But when you are exhausted, uncertainty can often prevail. Physical stress and exhaustion can also affect those emotions. The ability to weigh out all options and really come to a decision that is best for you and your partner can be influenced by a lack of sleep and that emotional fatigue. I see this in parents a lot when they're overwhelmed with all the ups and downs of those first couple weeks with baby. The thought of having to make a decision regarding your family planning seems kind of overwhelming, and how to juggle that and what's the right choice for you. We really encourage you to have a conversation with your partner and your medical providers about this before the baby. As doulas, we are really here to support you in finding the right information and education you need to feel like you are making the best decision for you and your family. So let's jump in. Another important aspect of this conversation is what we consider the one key question. And this one key question is, would you like to become pregnant in the next year? Your answer may be yes. You could want your children to be really close in age, and you may be an older parent who feels pressure from your biological clock. Your answer may also be no. You can't imagine having another baby right now, right? Just can't even fathom it. You may want to have another child, but not anytime soon, or your family may be complete. You may be finished. Your answer may also be that you're just unsure. You don't really know where to begin. Many of us can be overwhelmed by all the physical and emotional journey of babyhood and don't feel comfortable making that decision right now. So sometimes, as we'll talk in this webinar, we may have to make different decisions at different moments of that postpartum period. You may answer, okay, either way. Your faith in your journey may be linked with your connection to your religion, or you are just fine not to be in control of that decision. So there's 4 possible answers there, and what I'm asking you is to consider, what is your answer? What is your answer to, would you like to become pregnant in the next year? So let's talk about our options. There's so many options. There's pills, there's implants, patches, rings, IUDs, barriers, shots. Oh my goodness, so many. When it comes to birth control options after having a baby, there are lots of options for us. Which option may be best for you depends on a few different factors. And of course, it's always best to make that final decision in partnership with your husband or your committed partner or your health provider. They're going to know what is specific to you and your health and help you to make that decision. But tonight's webinar, I want you to be able to know what could be some options and help you kind of have that information so that you feel more comfortable going into that conversation with your healthcare provider. So those factors, right, what to consider include, when do you want to start taking birth control? Will you be breastfeeding? Which method is best for your current circumstance? When considering these options for birth control after having a baby, one of the first factors to consider is, when can you start? Some methods will require you to wait a few weeks to begin, while others will be available for you immediately after birth. Parents who wish to breastfeed must also be aware that some methods of birth control are not recommended until the milk supply is well established. If you have used birth control in the past, what has worked before may not be the best option this time. Discussing these options with your healthcare provider will be an important part of the decision-making process, and by taking your current circumstance into account, you can make a better decision. Birth control pills, the patch, and the vaginal ring are all considered combination hormonal methods of birth control. These methods contain both progestin and estrogen. The primary effect of these 2 hormones is to prevent ovulation. Birth control pills are taken by mouth daily. Most of these pills can be effective when taken consistently at the same time each day. So a lot of women will use a timer or an app on their phone to help them remember that they need to take it, or they're taking it in combination with something else that is okay to take along with it, so that they remember that specific time every day. And that consistency is going to increase the effectiveness as well. The vaginal ring is inserted into the vagina and encircles the cervix. It delivers a mix of progestin and estrogen on a continuous basis to prevent ovulation. The vaginal ring is inserted and left in for 21 days and then removed for 7. It is recommended that the ring be inserted and removed on the same day of the week and the same time of the month. The patch, or transdermal patch, is a method of birth control worn on the upper arm, butt, belly, or back. Like the vaginal ring, the patch delivers a mix of progestin and estrogen on a continuous basis to prevent ovulation. Every 3 weeks, the old patch is removed, and after 7 days, a fresh patch is applied. Benefits and potential risk of combined hormonal methods. Other than preventing pregnancy, one of the main benefits of combined hormonal birth control is that these methods may make your period shorter and lighter. They may also help lower the chances of period-related migraines, reduce unwanted hair growth, improve acne, and reduce the intensity of your menstrual cramps. The risk of combined hormonal methods may also include risk of a blood clot, lower risk of milk supply, risk of lowering milk supply, and a small increased risk of heart attack or stroke. Combining hormonal birth control can increase the risk of blood clots, specifically deep vein thrombosis or DVT. During the immediate days and weeks after birth, newly delivered parents are at an increased risk of developing DVT. Due to these factors, it is recommended that combined hormonal birth control methods not be started until at least 6 weeks post-birth. And due to the estrogen in combined hormonal methods and the risk of lowering breast milk supply, breastfeeding parents should avoid starting combined hormonal birth control until 4 to 6 weeks post-birth. By this time, the milk supply should be well established, and any potential impact on supply should be minimal. Because combined hormonal birth control methods have been linked to an increased stroke and heart attack, individuals who are over 35 and smoke are really discouraged from their use. If you have a history of heart attack, stroke, migraine, headaches, or deep vein thrombosis, your provider may recommend that you avoid this method of birth control. The progestin-only pill is often considered the most favorable method for those who are breastfeeding. This pill contains progestin and works by preventing fertilization of the egg by the sperm. The main drawback of this method is that it must be taken at the exact time every day. Like I mentioned before, a lot of women really love those apps that have a timer on them that can really help them do this, or they have a specific routine that helps them to remember to take it. It's really key because without that consistency, the effectiveness is drastically reduced. So if the pill is taken more than 3 hours later than the usual time, a backup method must be used for the following 2 days. The progestin-only pill is not recommended if you have a personal or family history of breast cancer. Other than preventing pregnancy, the progestin-only pill may stop your period and reduce overall menstrual bleeding. So this choice may be something that you want to consider if you are a breastfeeding mom and really just like are very consistent and a scheduled type of person. This might be a good choice for you. The birth control implant is a thin and flexible rod that is inserted under the skin of the upper arm. Much like the patch or the vaginal ring, this implant delivers a continuous dose of the hormone progestin to your body and prevents ovulation and the sperm from reaching the egg by thickening the cervical mucus. The implant can be placed immediately after birth, so it's one of those that you can get done really quickly after birth before you're even discharged from the hospital or at the postpartum visit. So if you have a 1 week and a 6 week postpartum visit, you can talk to your provider then. It also considered an effective long-term birth control option and is effective for 3 years. After the 3 years, the old implant is removed and a new implant is inserted. So for long-term spacing, you may consider this a good option for you. So always talk to your healthcare provider and see if this is an option. If you're a person who really isn't ready to have another baby anytime soon in the next couple of years. The implant may cause intermittent bleeding, and for some individuals, their periods may become lighter or heavier, last longer, become more infrequent, or experience bleeding in between periods, known as what we call breakthrough bleeding. For some individuals, side effects may include acne, mood change, depression, and headaches. The birth control injection. This is a progestin-only form of birth control too that is given once every 3 months by your healthcare provider. The injection works by preventing ovulation and is typically given in the upper arm or butt cheek. One of the benefits of this injection is that it can be given immediately after birth before hospital discharge. So that kind of like immediate, don't have to worry about it for 3 months. And like I mentioned before, sometimes women do a combination of choices as they don't know really what they want. So this is a sort of a short-term 3 month. You could utilize that if that was something that sounded good for you. The birth control injection may also reduce the severity of your menstrual cramps and result in lighter or no periods. Possible risk of the injection may include bone loss, breakthrough bleeding, weight gain, and tenderness of the breasts. There is a chance that the birth control injection may reduce breast milk supply, so it is recommended that those who intend to breastfeed wait 4 to 6 weeks post-birth to receive the injection. So you could get this at your 6-week visit if you were a breastfeeding mom. So barrier methods. Barrier methods of birth control include the diaphragm, cervical cap, sponge, spermicide, and condoms. They work by preventing the sperm from meeting the egg. Some of these methods can be used alone, and others will need to be used in combination with each other to prevent pregnancy. All right, spermicides. They come in different forms: creams, gels, films, suppositories, and all forms of spermicide that stop sperm in their tracks, but not dead in their tracks. These chemicals in spermicides prevent the sperm from swimming to the egg. In other words, they stop them from moving off with their little tails, so to speak. Spermicides also create a film or a barrier of the cervix to prevent the sperm from entering the cervix in search of an egg. One of the risks when using spermicide alone is that it does not prevent against sexually transmitted infections. The most common and readily available barrier method is condoms, right? Condoms can be bought over the counter and are the only method of birth control that can prevent sexually transmitted infections. Some condoms include spermicide, a chemical that we just spoke about that prevents those sperm from swimming to meet the egg. The potential disadvantages of using condoms is a possible allergy, especially with latex condoms. If you have a history of latex allergy, choose a non-latex polyurethane condom is a really good alternative. While lambskin condoms are also available, they do not prevent the transmission of sexually transmitted infections or STIs. Diaphragms and cervical caps are small devices, which typically made out of rubber or soft silicone. Both are inserted into the vagina before intercourse and must be used with spermicide to prevent pregnancy. The contraceptive sponge that is made from soft plastic is the one-time use form of contraceptive. All three barriers have the benefit of being methods that do not involve the use of hormones. Because these methods are inserted deep into the vagina, it is recommended that they not be used until 6 weeks post-birth checkup. So this is not a use right away method. And also until you have been cleared by your medical provider. So again, this might be something that you could consider at that 6-week follow-up visit with your provider. So if this sounds something that you might be interested in utilizing, definitely speak with them. The diaphragm is a shallow bowl or cup saucer-shaped cup that is made of silicone. It is placed inside the vagina, covering the cervix before sexual intercourse. It must be used, must be used with spermicide in order to prevent pregnancy. Diaphragms are available at the pharmacy, but your healthcare provider must determine the correct size. So you really want to have the right size since that can change post-birth. And they will write a prescription in order for you to obtain one. Your healthcare provider or nurse will also teach you how to insert it and remove it. The diaphragm contains spermicide. The diaphragm containing spermicide should be placed in your vagina up to 2 hours before sex. If intercourse begins more than 2 hours after insertion, it is necessary to reapply spermicide to prevent pregnancy. The diaphragm should be left inside the vagina for up to 6 hours after intercourse and can be worn for up to 24 hours. So if you have sex more than one time after the initial application, additional spermicide should be used and applied inside the vagina. After each use, the diaphragm should be washed with warm soapy water and left to air dry. Optimal storage is a clean, dry area out of the direct sunlight and away from extreme heat. If you have been previously fitted for a diaphragm before pregnancy, of course, have your provider resize you because that could have most likely changed after birth. The cervical cap. Many eons ago, this cervical caps were used. Some women still use these. It is made out of a soft silicone. Unlike the diaphragm, the cervical cap is shaped like a sailor's hat. It is placed deep inside the vagina, covering the cervix. Kind of makes a little seal around the cervix. And they are available at the pharmacy. Your healthcare provider must determine the size. So this again has that issue if you've never had a baby and then you have a baby, your cervical size is oftentimes going to change. So you definitely want to be resized so that you're certain that it is going to be it's going to be correct size and fit to avoid getting pregnant. The cervical cap can be left in place up to 2 days, but is considered less effective than the diaphragm in preventing pregnancy. The cervical cap is also considered less effective if you have given birth. For this reason, some providers may recommend a diaphragm instead of the cervical cap. If you have sex more than one time after the initial insertion, additional spermicide should be applied, similar to the diaphragm. And the cap must be left in place for at least 6 hours post intercourse. After each use, you want to wash it with warm soapy water and let it air dry. Again, similar to the diaphragm, a clean, dry area out of direct sunlight and away from heat. The sponge. The contraceptive sponge is a small, round sponge that is made of soft plastic. Like the diaphragm, the cervical cap, the sponge is inserted deep into the vagina, covering the cervix, and the use of spermicide is necessary to prevent pregnancies. Unlike the diaphragm and cervical cap, the contraceptive sponge is a one-time use method and is discarded afterwards. It does not protect against sexually transmitted diseases. To use it, you can remove it from the wrapper, wet with tap water, squeeze the sponge until the suds forms, activate the spermicide, and insert the sponge while it is wet and foamy. Much like the cervical cap or diaphragm, it is folded and deeply inserted into the vagina, covering the cervix once in place.
The contraceptive sponge can be inserted up to 24 hours before intercourse and should be left in place for 6 hours after. Unlike the diaphragm and the cervical cap, once it is used in place, you may have sex as many times as you'd like to with no need to replace it or use additional spermicide. The sponge does not require a prescription and can be purchased online and found at most drugstores. The LAM method is a form of birth control that is used in the first 6 months postpartum by exclusively breastfeeding individuals. So the LAM, or lactational amenorrhea method, there are certain conditions with this method that must be met in order to ensure an effective birth control. It as an effective birth control method. So with lactating people, oftentimes the hormones that women have through breastfeeding can delay or delay your fertility, but you can also be fertile before you actually have a cycle or a period again, which can be very difficult for a lot of women to know. And nobody knows, if you've only had this is your first baby, you have no kind of idea about when that cycle is going to come back. It's definitely not a foolproof method for many people, and thus a lot of your provider, that would be something to talk to your provider about. The demands just on your nursing body really are what is associated with this method. It really relies on 3 criteria. Menstruation has not returned beyond the first 8 weeks. The baby is fed on demand. So pretty much whenever a baby needs to nurse, they're fed. And at least every 4 hours during the day and every 6 hours at night, exclusively from the breast, meaning that you're not supplementing with anything at all. And baby is less than 6 months old. So I have a lot of moms too that will sometimes not want to conceive again and have trouble with their fertility because they're breastfeeding. But I do caution people to use this as a sole method of birth control, as it can sometimes be hard for women to really know. And we can, of course, ovulate before we have that first period, which could open you up for pregnancy. Yeah. All right. The IUD. This is a method that a lot of women may choose if they are wanting to, when they respond to that one key question, they say no. And if that is either they're finished having babies or they do not want to have babies for several years, the IUD or intrauterine device is a tiny T-shaped device that is inserted through the cervix and into the uterus to prevent pregnancy. There are 2 types of IUDs available in the market, the copper and the hormonal. The copper does not contain hormones and is effective at preventing pregnancy up to 12 years. This copper IUD, I have had experiences with women who have had an adverse reaction to copper. So please definitely speak with your provider about what is the right IUD for you. Okay. The hormonal IUD contains the hormone progestin to prevent pregnancy by preventing ovulation and thickening the cervical mucus. The hormonal IUD also can last 3 to 6 years depending on the brand. So both types of IUDs change the way the sperm move to prevent them from reaching the egg. For some individuals, there is an adjustment period to the IUD. The side effects can include cramping, spotting between periods, and heavier periods. Possible risk include infection, the IUD slipping partially or fully out, and in rare situations, the IUD can become embedded or poke through the uterus to require surgical removal. So one of the key aspects of placement of an IUD is to have it placed by an experienced and trained provider, so that they can accurately place the IUD for you. And I've talked to many providers and many women, and I know that that is very key in the outcomes for your IUD. So definitely have that conversation with your provider. Sometimes you may be working with a group of providers, and some of the providers there may be more experienced in it, and that might not necessarily be your provider that you like. But if they have a lot of experience with placing IUDs and are really good at it, then you may consider going to them for that specific thing. All right. So if you were one of those people when asked that one key question and you said, no, I do not want to get pregnant in the next year and maybe never again, right? So if you want to permanently have no more children, there are two main types of permanent birth control. For those with male reproductive system, it is called a vasectomy. And for those with a female reproductive system, it's called a tubal ligation. The tubal ligation is a surgical, sometimes called a tubes tied, having your tubes tied, is a surgical procedure that severs and then blocks the fallopian tubes. This prevents the egg from reaching the uterus and the sperm from reaching the egg. This may not be the easiest option for permanent birth control when a birthing person is having a vaginal birth, but if you're having a cesarean birth and you know that you are not going to want any more children, this is a good option. No additional surgery or anesthesia is required. It can be done at the same time as a cesarean. And then for those of you who have had a vaginal birth, it can be done the day after, before discharge from the hospital, or you can come back and have that done. This option does require general anesthesia to put you under, and and an epidural. So unlike tubal ligation, the vasectomy for males can often be performed in a doctor's office or a clinic. They use a local anesthesia. The provider severs the vas deferens tubes that carry the sperm out of the penis. Many providers also burn or put clips or tie off the tubes as a part of the vasectomy procedure. It can take up to 3 months for the semen to be sperm-free. So sex after a vasectomy should be protected with another birth control method until that your health provider clears you. All right. Making a decision about post-birth contraception is a normal part, right? So everybody's kind of going to come across that after you have your baby. It's not the funnest thing to have to think about or deal with when you're trying to take care of your baby and just recover and all of that. It can be overwhelming, but it is a part of your journey. After hearing about the different options that you have, are there any methods that might appeal to you that you're kind of going, that might work for me, or I'm going to ask my provider about the IUD? It's important to kind of start having those thoughts, and also to have those conversations with your partners. So our husbands, our wives, our partners are an important piece of that decision-making process when we're talking about that one key question and our postpartum family planning. So I really want you to note that your healthcare provider can be a really good resource for you, as well as your doulas. There's also wonderful family docs that will talk to you about that. So really reach out and talk. I will send out some information, some good resources and websites for you all, so that you can find some online resources to further your thoughts on this. Definitely give us a shout out in the comments if you felt like you really connected with a specific type of method for yourself, and or if you have any other questions that weren't answered. So I will definitely put some sources and resources on when I put this up to YouTube. So definitely take a look at those and get connected with those different options and the different brand names that they have. So you have within your contraceptive options, you'll have brand names and off-brand names. So talk to your provider about those differences. You may also be influenced by what your insurance covers. So also talk about that and let your provider know what insurance you have so that they can help you make that decision that's right for you. Thanks so much for joining us tonight. Again, my name's Allison Rollins, and I really want you to have all the information that you need to make the right choices for you as you go through that first year with your baby. If you have other questions, please reach out to me. Our email address is info@highcountrydoulas.com, and our office number is 828-278-8949. We do provide labor and birth doula support as well as postpartum doula support for families who would like to have that extra set of hands and that extra set of one-on-one support to make that the time that we have our babies just go smoother. It's a happier, healthier experience for a lot of women and their partners. Thanks so much for joining us, and have a wonderful day.